All right.
Yeah.
So we're going to divert our normal show format and explore a case study. So I shared this case study with you. I'll share it with our audience, and then we're just going to dive into it. So here it goes. And this, if any by any chance this reflects your situation in your health system, this is not based on your health system. I'm just
Names have been changed to protect the innocent,
Yes,
right?
exactly. So this health system has 18 acute care hospitals on 2 different EHRs with regional customizations operating in 4 states. The health system participates in 2 ACOs that utilize point-to-point integrations between disparate EHRs and separate systems to produce reports and house registries. The health system has several medical groups on different but a single EHR platform, and a clinically integrated network that has 50 distinct EHRs represented. The medical group utilizes their own EDW to generate metrics for the clinically integrated network and for their other constituents. The health system participates in 3 different regional health information exchanges that transfer data with CCDs, obviously across CCDA format. The system level at the system level, they also have an EDW that was created 5 years back, and the demands on the team are really overwhelming. The team spends a majority of their time cleaning the data in order to produce a set of reports for their constituents. Every year, the data team makes a request to grow the staff by about 20%. The executive team is asking for a set of reports across the system to measure clinical and operational performance. Today, the variability of the data and the definition of the terms makes comparison very challenging for the executive team. There's a feeling amongst the leadership team that their investment in systems is making their investment in systems is in analytics and the EHR, that they should be getting a lot more value from the program for the money that they've invested. Their plan is to hire a hotshot data CIO or chief data officer to save the day. And Dale, congratulations. You've just been offered and accepted the job. So we appreciate you joining the organization to help us sort of move through this. I'm excited.
Yeah, this is a great scenario, Bill. Nicely done.
So do you, I mean, you see elements of this across the
yeah.
industry as you go out there, right?
Oh, yeah, yeah. I mean, this is the norm now. As complicated as it sounds, it literally is the norm.
Yeah, and that's, all right. So the stated goal from the executive team and the clinical executives and whatnot is that they would like to utilize data to rapidly and continuously improve clinical, operational, and financial performance for the health system and the care providers. So for our organization, we're going to organize it into really 6 topics. We're going to start with discovery. You're starting your first day. We're going to look at discovery, what you need to discover. Second thing is preparing the organization for change. The third being the components of a healthy data utilizer. Fourth being operationalizing the program. Fifth being the technology. And 6th being ongoing care and feeding of the program. It's interesting because so many times people want to start with the technology. If I just bring this in, all these problems will be solved. But we know that that's not the case. So let's start with discovery. Where are you going to start? What are you looking for? What data do you need to gather? Who do you need to talk to?
You know, I literally putting my hat on as if this were my first day. I would start in the usual way, which is you've got to get out and meet all the major influencers and constituents and start building relationships. I always say that there's nothing more political, especially in healthcare, than data and its utilization. People think that deploying an EHR is brutal culturally, but you'll eventually get past the pain of deploying an EHR. But the politics of data and the politics of utilization of data and the light that it can shine both accurately and inaccurately on people and their careers and processes is what makes it so political. So, you know, for the most part, we've almost commoditized the technology, right? The public cloud has made the infrastructure pretty easy. You know, I'm humbled by the progress we've made with Health Catalyst. Other vendors have, you know, technology that sits on top of public cloud infrastructure that makes the tech almost a commodity. So I would plan on spending about 80% of my time in marketing the value of data to the organization, and also making people feel trustworthy and trusted, and and building those relationships. I gave a lecture out in LA yesterday to a group of folks that are interested in collaborating and sharing data. They're brought together under a common mission, but a disparate governance structure. And I shared with them that I spend most of my time now advocating the soft side of data and the human side of data. And I'm going to reference an old Harvard Business Review article I read years ago, so long ago I can't even remember now when it came out. But it talked about the ways that the characteristics that are important when you're trying to influence and collaborate with people. And it boils down to 3 characteristics. The first characteristic is the person on the other side of the table has to feel that you have overlapping values in some areas, that in essence, that you're honest and trustworthy, and that you have their interests in mind. So they have to feel good about overlapping values. And of course, if you're working across cultures and countries and things like that, it's sometimes hard to find those overlapping values. But for the most part, honesty and trustworthiness and having a genuine empathy for the person across the table is a pretty common way to establish overlapping trust in that first characteristic. Yes. So that has to be genuine. It can't be manipulative, right? Yep. The second thing is you have to have a direct sense of empathy for the role that the person occupies. You know, and the classic, example is an IT person talking to a physician about how we're going to improve their lives with technology. It's not unusual for us as IT people to alienate those clinicians because we've never been in their shoes. So if you can't engage in a conversation with a clinician with a sense of direct first order empathy with them, then at least bring a partner with you, bring a physician partner with you to those conversations, or bring a CFO or someone from the finance team with you. But the person sitting across the table from you has to feel that you've got first order empathy with the situation that they occupy. And so there has to be a big overlap in that capacity in addition to the values. But then the last of the 3 traits that's really important is the person on the other side of the table has to feel like you have expertise and skills that they don't have, but they value. So you have to bring something to them that's common in the first 2 characteristics, but you have to bring something to them that's unique and valuable to them. And so that's the first thing I would start doing is engaging with people in the organization in those positions of influence, reminding myself constantly of those 3 characteristics that are so important to affect change.